Welcome back to The Big Picture. We have been talking about summer break today. It is on the horizon for a lot of students, not for us. Wow. Oh, well, because we're adults.
Yeah, you kind of got your summer
A lot
break.
of people, especially you have kids, are planning your summer vacations. You're heading out on cruises. And right now, unfortunately, two diseases are making the headlines. We're talking about Ebola and hantavirus. And they sound kind of foreign and distant, but it could hit closer to home. And I have a lot of questions about it. So joining us today, we have Dr. Megan Buhler, infectious diseases with OhioHealth. Thank you for joining us today.
Hi, thank you.
Hi. Okay. So when people hear these diseases, hantavirus, Ebola, making the headlines, how concerned should the average traveler be?
I would say unless you were recently on MV Hondius or you're recently returned from the Congo, really low concern for the average U.S. traveler, Central Ohioan traveler.
When we talk about cruise ships, which is, how hantavirus started circulating, when it comes to the spread or prevention of infectious diseases, what should people do regarding their health and their safety if they're getting on one?
Yeah. So prior to any travel, I always recommend making sure you're up to date on just routine vaccinations, your flu, your COVID vaccinations. Always, if traveling to other countries, looking at what other recommendations for vaccines or prophylactic medications are recommended through the CDC's travel website. And then just making sure you're healthy prior to travel. We don't want you getting on a crowded cruise ship if you're feeling unwell. Make sure you have all your home medications with you, and just, good hand hygiene is always going to be of utmost importance anytime you go anywhere.
And, the work of infectious disease specialists and doctors is so important because we talk a lot about, for example, this most recent hantavirus outbreak, contact tracing is so important. Why, for the folks out there who might not have paid attention during the pandemic or this recent outbreak of hantavirus, why is contact tracing so important, and how does it help really kind of stop something from getting out of hand and spreading?
Yeah, so with contact tracing, we're trying to find anyone who may have been in contact with a symptomatic patient or pre-symptomatic patient where they could have been in that transmission period and potentially infected with whatever contagious pathogen we're looking at. So if we can do that, we can potentially prevent additional exposures if that person were to become symptomatic, and are monitoring so they can receive prompt medical therapy treatment if they do develop symptoms.
If someone starts feeling sick on a cruise ship or on a trip, when should they seek medical attention? Because some cruise liners, they have a doctor on board.
Yeah, so I think, especially in cruises, we know much more common than anything like hantavirus, gastrointestinal disease or stomach flu. We hear about this not uncommonly, at least once or twice a year. So any sort of gastrointestinal symptoms, any nausea, vomiting, diarrhea, I would report those very soon on, just to make sure that other passengers are not developing similar symptoms. And then, I think anytime people are at the point where they're unable to eat, drink, keep hydrated, having any breathing difficulties, new onset confusion, those are always going to be things that we'd want to get evaluated very quickly. Persistent fevers, or anytime you would consider going to the doctor while unwell back at home.
All right. Dr. Megan Buhler, infectious diseases with OhioHealth. Thank you so much for joining us today. All right, everyone, be safe if you're traveling internationally. Just be aware of your body and your health and kind of like what your level standard of healthy normally is. You know what I mean? Keep track of all of that.
And it's important. Yeah, it's important, as she kind of alluded to, of we're hearing about, obviously all of those on the cruise ship who are, now in the quarantine situation. Some of them are out in Omaha. And then, the Ebola outbreak in the two countries in Africa, the Democratic Republic of the Congo and Uganda, you hear about those, but how they spread, the CDC has also mentioned that, CDC and the World Health Organization have mentioned, how these are transmitted don't really give that kind of spread that we saw with COVID. So it's not something to be overly,
but be aware.
Worried, but be aware. Be aware. When I was health conscious.
Right. And when I was getting off the plane in Japan, they were making us step over these antibacterial things because of some virus in China. It was like a lot. Yeah. So just be aware. Be aware.